She's a wonderful homeopath and uh, Indian homeopath, practicing since how many years?
19 years.
19 years at Harmony Homeopathy Clinic. And she was awarded the esteemed title Woman Leader in Holistic Health and Homeopathy by celebrity Divya Dutta on April 26th, by the way, 2025. Only 1 year at the same day. So I'm happy you came by chance, but we know there are no chances. Probably you have very important message to us. And it's a simple yet powerful journey into mankind. Through her complete scientific healthcare system, she adapts classical homeopathy to modern times by using genetic, biochemical, and personality markers. This approach creates a life-changing connection between mind and body, enabling her to take on challenging cases with remarkable results. She was completed her homeopathic studies from Madhum Homeopathic Medical College, Singapore. She has done the diploma from AICH Greece, and she cultivates a wonderful blend of curing and healing through exceptional natural health-lining, intuitive skills, and experience of homeopathic practice. So her team will be pediatric cases, which are one of the most exciting and difficult because children didn't speak. And what seems to be is not the case. We have to be very skilled and like Sherlock Holmes would penetrate behind the scene, behind the visible. So you can begin, Rita. Look forward.
Namaste, everybody. Thanks, Genoveva. We are connecting again after, I think, 3-4 years. I'm glad. I can share my PPTs, right?
Yes, you can share.
Hello, everybody over here. It is hot summers in India.
You see my jacket?
And you're chilling over there, I suppose.
No, it's warm, but the sun is still not shining in this room. And so I hope afternoon I will remove it.
Okay. So we'll begin.
Is there anyone who can't see Bulgarian translation? Ioanka, can you ask them?
Yes. So pediatrics, little kids. Going further, we'll just start.
Иванка, Петър казва, че глъхнеш. Може ли да се приближиш до микрофона? Благодаря ти.
I'm audible to everybody?
I had to fix something with the translator. Sorry, Rita.
Yes.
You can go on.
Okay. So we'll go further. I think I am audible to everybody. Right. Okay. So when we talk about pediatrics, the little kids, modern homeopathy, modern medicine describes pediatric from they're born till age of 18. That is what pediatric age group falls into. And generally we also see accordingly. So it is going to be a one-to-one interactive session. So I will like if anybody is asking questions in between as well.
Rita, sorry, can you request for a little bit slower thinking because I'm still adjusting something with the translator. Thank you very much again.
Okay, we'll start in a few minutes again then. I'll just hold.
No, just speak slower.
I have to speak slower. Right.
Thank you.
Thank you. So
It's
the age group,
difficult. It's difficult for the even the translator is very good professional, but
right, exactly. Okay. So the pediatric age group is from modern medicine, or when we have studied medicine, it begins from age 0 to age 18 years of age. But we as homeopaths, we do not consider pediatrics only from age 0, from the day of birth. Happy birthday day. No, pediatric case taking actually begins when it has been conceived, from the day of conceiving. Okay. So that is what pediatric case taking happens in homeopathy. We do not just see today is the birthday, and so the history starts from the day of birth. It is from the time when it is conceived till the patient has come to us. Okay. So going further, I will just have a glimpse. Okay, every organism over here, human beings, plants, animals around us, everything, every living thing has a vital force. Vital force is the soul which animates the living thing, because of which we are moving, because of which we are expressing ourselves, because of which we are going through this journey from life till death, and probably coming other lives as well in the whole lifetime. So we have all, so Dr. Samuel Hahnemann, our master, giving tribute to him, this is a homeopathic month. We all are aware of the qualities of vital force. I am Jain, my culture is Jain. So spirituality believes very much in the power of soul, the power of the vital force. So whenever we are born with existing qualities of the vital force, which are always going to be there with the vital force. But somewhere or the other, they are blurred, or they are covered, or they are not allowed to manifest completely because of the miasm around the vital force. So vital force has basic qualities. It has inbuilt the default settings of a vital force is having peace, having love, having power. And these are all in abundance. It is not small quantities. The vital force has all these qualities. It is happiness, it is bliss, it is lots of knowledge and purity in abundance. So when a normal person is leading a normal life, he might not experience these all qualities in abundance. But if he is not diseased, he is experiencing these qualities in little quantities, and he is going further. He's experiencing peace, he's experiencing love and power and knowledge. But whenever the person is coming to us as a homeopathic physician, these qualities of vital force are altered, they are changed, they are blurred. And so, as physicians, it is our major task to repair this deranged vital force. What is our Samuel Hahnemann sir saying? That we have to arrange this vital force which is deranged due to any of the factors which might be intrinsic or which might be extrinsic. Okay. So when we go further, yes. So as I said, the vital force is deranged because it is camouflaged or it is blurred with this miasm. Okay. When we read the Grantha, as homeopath, as being a Hindu as well, this Grantha Bhagavad Gita, I am trying always to correlate our organon of homeopathy medicine with our Granth Bhagavad Gita, which actually explicitly and elaborately says about vital force, the qualities of the vital force. So we as human beings already have default setting in us to heal our own selves. And when this healing power is blurred, or when it is covered or obstacled with this miasm, we need homeopathic treatment. We need a treatment. Okay. So this Granth, Bhagavad Gita, it says that Mayasm is a Sukshma Sharir. It is a Sukshma Sharir. It is the Kashai, the mind and intellect and the emotions which are altered, and they alter the manifestations of the vital force. So when we are attached to these emotions, to these kashais, our miasm keeps on enhancing. So whenever we desire, once the mind, which is this part of the miasm, whenever it keeps on desiring or whenever it keeps on wanting, the seed is sown. So whenever we keep on desiring which is out of limit or which is destructive or which is out of ignorance, we are sowing the seeds in our miasms. And it will keep on making us unhealthy in this lifetime, in coming next lifetime, and coming many more. So what as homeopaths we have to see is we have to look out to this miasm. Miasm, which is a covering, which is altering our vital force, we have to look at it. Okay. So our wants, our desires is adding things to this miasm again and again. Okay. We are born also because we have this miasm. Otherwise, we would have been liberated souls. If this miasm is gone, like enlightened souls like Buddha, Mahavira, we would be free of this miasm. But that is a process, that is a journey of life, many lives to come together. So we have miasm, so we are taking birth. And when we are having miasm, when this miasm is dormant or it is silent, it is not an active modem, then we are not having any disease, per se seen diseases. But whenever any wants or desires or the seed is sown to it, or if my respect is hurt, or if my emotions are hurt, if I'm not getting the position which I want, if I'm not getting the love which I want, these are all the causations which we take. And these causations, when they are sown into the miasm, we are tied up into a conflict. This conflict gives rise to diseases. I think I'm audible to everybody. Yes. So this is what I was talking about, the subtle body, the Sukshma Sharir, the miasm, which many scriptures in Indian civilization have been mentioning, Bhagavad Gita, the Agams in Jain traditions. They mention about this miasm, and these are centuries old granth, which are explicitly telling about, which are extensively telling about miasm being the basic cause of the disease. Okay, so whenever we are trapped into the conflicts because of this miasm, the disease comes out. So the conflict of knowledge will give sora because of the sora. So which miasm is predominant depends on the action which is thrown out. We are born with all these miasms at one times. When one is active, the other might be dormant. When both are active, the other might be dormant. Or it might be a phase that every miasm is on an active phase. So conflict of knowledge, sora. Conflict of ideas is psychosyphilis. Conflict of ego is sora psychotic. Conflict of goals is psychosis. Conflict of feelings is psychosyphilis. Conflict of ownership is syphilitic. So whenever any trigger happens, whenever any external causation happens, it will hit at the place where our sensitivity is, where our sensitivity on this miasm is. If our predominant miasm is sora and an event comes, we might be affected on the soric level. If our predominant miasm at the moment is psychosyphilitic and an event come, we will be producing diseases which are psychosyphilitic. So we are there with all the miasm. The whole life journey will be along with this miasms. It depends on which state this miasm is activated. So what is the aim of our homeopathic medication always? We have to eradicate syphilis, we have to refine psychosis, and we have to establish ourselves in sora. This is one of the very beautiful sentences I've learned from my mentor, Dr. B.S. Bhosle sir. He's practicing homeopathy and cured wonderful cases since 25 years. He's mentioned all this in his book, The Process, Dr. B.S. Bhosle sir. So when we are treating a case, we have to see which predominant miasm the patient has come with it and what we are dealing with actually. Syphilis, psychosis, or sora. Okay. So this is the background of miasm. So when we are dealing with pediatric cases, when we are dealing with children, those who will not give us too much of history, those who will speak less, they will act more. So observation plays very important role. History taking plays very important role. We have to take the history not just on the date of the birth. We have to take history, the past history of the parents as well when we are treating a pediatric case, when we are treating a child. Because the seed has been sown then during the conceiving, which has given birth to the disease now in the lifetime. So when we know the miasm, when we know what we have to treat in a man, the man has come with what predominating miasm, we know what we have to take in the history. So when we are treating pediatric case, especially when we are treating autoimmune cases in a pediatric age group, that time history of the parents from the time of conceiving is very important. So when they conceive, the two cells, ovum and the sperm coming together, they already have the individual vital forces. They already have their individual miasm around it. And then they are forming a new life ahead, which is carrying forward, inheriting the miasm of the parents along with. So we have to take history before conceiving. The mental and the physical makeup, the social status of both the parents when they conceived, in what conditions they conceived. Was it a love marriage? Was it a happy marriage? We have to see and study the environment of both the families and the parents when we are taking a pediatric case. The history is not complete if we do not go to the roots. Okay. The health problems, the medicines consumed by the parents is very important. The mindset of the parents during the time of conceiving is very important. Okay. Then comes the gestational age. Okay. In Chinese calendar, they do not consider the birth age from the date of birth. They consider the age of the person from the date of they conceived. So that conceiving period is very important. When the ovum and when two cells come together and they start developing into the gastrula, morula, blastula, and further into the body organism, the neural tube is formed. Every phase is very important. So the mindset of a mother, the mindset of a father, the circumstances, the environmental features during the conceiving is very important whenever you're studying pediatric history and especially autoimmunity in pediatric. Okay. So what it counts is the physical stressors, the social position, the financial problems, the food and diet, which the mother had been taking, any medication, any impactful incidents which has happened in mother's life during conceiving is very important to study the case of autoimmunity in pediatric. So this is, if there are doctors over here, we have been studying this image always, how the neural sheath is formed, how the neural development, the brain stem is formed, how the organs are formed, how the further development of a child happens. So every event during the pregnancy, for example, if there are miscarriages during pregnancy, the 3rd month, the 2nd month, the 5th month, the history has to be taken. The mental condition of a mother during any of these stages during pregnancy has to be considered. Because we might have patients who are born handicapped, who have born with any syndromes because of the chromosomal abnormalities. We have children who have autoimmune diseases. So this history, the journey in vitro is very important. When we are going further, how was the delivery? How was the position of the child during the delivery? Any medications? The mental state is importantly to be noted. Then comes the another soul. The first soul in the journey was the mother, because it was in vitro. The child was inside the womb. So the history of the womb has to be taken. This is one soul, one vital forces energy which we have studied. Now we will study the vital force which has come to us to be treated. Vital force is not affected, but the miasm is making it weaker. So when the health status of the child during the birth has to be noted, the weight of the child, the birth trauma, was it a normal delivery or it was a C-section? The important phase next is, which Dr. Patricia has also mentioned, the mother-child bonding, the breastfeeding, the vaccination history of the mother and of the child. These all symptomatology has to be taken into consideration when we study a history of a pediatric age group. Okay, we have many rubrics also, ailments from vaccination. We have.
Slow down, please.
I have to speak slower. Right. Right. I'm so sorry.
Thank you. Thank you. It's
Yes.
difficult for translator to think that fast. You're clever, but
No, I'll slow
but
down.
in translating so many speakers and different approaches, I know how it is because I've been a translator and I'm still also.
I will speak slow.
Thank you, Rita. Sorry for interrupting.
No. Thank you. So the birth trauma which has happened, the C-section, or it is a breech presentation, it has to be considered and noted because that will identify the miasm with which the child has come. Okay. We have normalcy for everything. We have normalcy standards for birth, which is through head first and then the legs coming last. So this is the normal way every child is born. So whenever it is not in the normalcy standards, we have to look for it, which is PQRS for the child, if it is a transverse birth, or if the umbilical cord is around the neck, if the mother has been vaccinated or the child has been vaccinated or not after birth. After the birth, the mother and the child's bonding is very important. So once this history for the miasm which is coming up is being taken, we have to do observation by the parents. What parents tell about the child. Okay. So when we are studying a pediatric case, it is not only the child, we are also seeing the mother's history, the father's history, the conceiving history, the environment, the observations of the parents and the observations of the surroundings, how the child behaves at home, how is his behavior in presence of the strangers, is the child's attachment with mother and other family members normal? Because as the qualities of the vital force, peace, love, power, knowledge, we have to look out कि these all normal qualities are there or it is deviated in that child. If it is deviated, these normal vital force qualities, then we have to see what is the deviation, and this deviation will give us the miasm, to what level it is deviated. For example, peace is one of the important qualities of the vital force. And if the child is very destructive, just very angry, it is very hitting others. So what is our aim as a homeopath? We have to establish this child who is syphilitic, destructive. We have to refine it to psychosis. We have to and establish it into SORA. So the journey we have to reverse from syphilitic child to the SORA with homeopathic medicines. Okay. So when we know what we have to cure, where we have to bring this syphilitic child to, we have to bring back to the qualities of the vital force. We have to enhance the qualities of the vital force. So that is the most important Hering's law of cure. Once we know the qualities of a vital force, then only we can know that the child or the person is developing or improving on the qualities of vital force. Okay. So going further, we were talking about how was the relationship of the child with his parents, with surroundings. You have to see the milestones, teething, uh, fontanelles closing, the bone sutures closing, walking, talking, all these milestones have to be considered. Okay. So this is what we have to see when we see a pediatric case. So we have to be very, very good observer. We have to be unprejudiced observer. We have to see the child as it is. If it is coming dancing and frolicking, we have to see that it is coming dancing and frolicking. If it is coming in the entering the room, clinging the parents, we have to see it is clinging to the parents. See as it is. We are wearing specs to see clear, but we have to see what color of specs we are wearing. So we have to see it transparently. We have to see unprejudicedly to the patient. Okay. Going further to autoimmunity. Autoimmunity. What is autoimmunity? I think I'm audible to everybody. Yes. And I'm slower
Rita, can you
also.
ask? Rita, can you ask whether Bulgarians hear the translation? And thank you.
Yes.
Because I'm not sure they see the chat.
Everyone is seeing all the delegates are able to hear me. If yes, just show me a thumbs up. I think yes. Should I continue?
Yes.
Right. Okay. So what is
But
autoimmunity? Autoimmunity, as I said, as we all know over here, our organon says, and it is known since years and centuries, that we are by default settings fitted with self-healing. We are fitted with a technique where we can heal our own vital force. But in autoimmunity, this healing power turns an enemy against its own self. The cells are so confused that they cannot identify into a foreign body or a self cell, and they start fighting with it. And so autoimmunity sets in. So when we consider autoimmunity, it is destruction because there is a confusion of the cells between its own self and an external self. They are mistaken कि what is the own self, or there is an alien cell in that, or there is a foreign body inside the body. So when autoimmunity is dominant, when we are taking the history, we actually need to go to the roots of the case, the time when it is conceived. Then only we can treat autoimmunity. Okay. So we'll now go into a case. I hope I'm clear till now. We'll see a case of autoimmunity. These are the reports. The patient came to me, a child came to me, 6 years old child, 7 years old child, with a strong ANA positive test and a strong ANA blood test, strong positive. So these are the reports which I'm showing in advance only. So there was a girl who was 7 years old, and she entered the OPD, entered the clinic with immense swelling on her feet and legs. We could just see it as she was entering the clinic. She was dragging her legs. She was supported by her parents, and she was coming with the immense pain. But I observed that her legs were very heavy, it felt. She couldn't even lift her legs. She was dragging her legs. Parents were accompanying her, but she was in tremendous pain. She's a 7-year-old child. So when we started with the history, the parents showed me these reports which I have shown. ANA was strongly positive. Autoimmunity or anti-nucleic antibodies were very strong. IgM was very high, and all this antibody, the SMRNP antibodies are strong positive. So she was with a very difficult autoimmunity. When probed into the case, she said that my pain and swelling Her parents were saying, and even she was telling the same thing. My pains and swelling came suddenly. But when she entered, I was observing ki she's having so much of pain. She's dragging her leg, but then too she's smiling and she's greeting me. Hello, doctor. How are you? And I was just thinking, oh, she's so sweet. Such a sweet child she is. With the pain also, the pain had come very suddenly and it had come with a very high fever. Luckily, this patient was referred to me by an allopathic doctor who was my friend, a modern medicine doctor. So she had not prescribed any antibiotics, nor any other medications, nor any steroids to this girl. So she was a very fresh case, not treated with any other medication, just antipyretic crocin. Paracetamol was given and she came because of the high fever and she had come to the clinic. So came with the high fever, swelling of the hands as well and swelling of the legs. When I touched it, they were hot. The extremities were hot to touch. So this case was not altered with any other medication. This was not deformed with any other steroidal medicines as well. Because knowing it is autoimmunity, directly the patient is started on higher steroids. So when she came, I just observed her. She was smiling, greeting me, a chubby child, a 7 years old child weighing 36 kgs. She was very fair skinned and very thick and long hair at such a small age, long hair till her waist, thick. She came in the consulting room with the pain and she was smiling and greeting at me. Okay, so she was communicative. When I inquired further, when I asked her, what is happening to you, Bacha, what is happening to you? How are you? She's saying, there is little pain. And she was tearful. It could be clearly seen that the pain is so immense, but she's saying there is a little pain. Okay. So when further inquired, the pain had begun suddenly. There was a sudden fever and the pain was suddenly there and she couldn't lift even anything. It started in the school itself. She couldn't even write suddenly. She couldn't even lift the pen and write. So these were her symptoms only, nothing else. Pain and swelling and hot to touch and smiling. So only this much totality was given to me. The chief complaints were this much only. Further probing, her appetite was always good. She is very much fond of fish. Motions were soft, clear. The only thing was she felt easily cold compared to other people around. Whereas in India, it is always hot. So she felt cold easily. Moderate perspiration, no smell. Okay. When further probed, asked her mother said that she is very disciplined at home. She does all her work on time. Uh, and her mom was also working. So she stays with her grandparents. So she always had this, my mother is not around me. So I have to behave good. I have to behave disciplined. I have to behave neat and tidy. So she always tried to be very good child, like Dr. Ashok sir said, a good girl. She was always neat, clean, doing all her work on time. She wanted all the things in order as well in the house. Okay. Uh, Mother said that she's very creative. She likes to decorate her home. She does good artwork and craft. And she does not tolerate too much of noise also. She likes soft music and she stays calm. In her school also, she has few friends and she mixes up well. But she's always very much conscious about her image, what people will speak about her. In last few weeks, when probed further, how does disease came up? How this disease came up to her? Her mother said a small incident which happened in her school was in last few weeks, she was being taunted and troubled by her friends due to her weight. Due to her weight. And she was trying to ignore it. But she used to come and tell at home that my friends are taunting me and troubling me because of my weight. Further, when asked, she was a very obedient teacher to the student to her teacher. And these few friends of her, they wanted to do some mischief and they did so. And in a prank, they deliberately put her name in front of the teacher. And now this incident was very much hurting for her. Okay, now I am the victim over here. They have made a prank and I am there in front of the teacher who has not done any mischief. I have been always obedient, but then she was in sudden fright. She got terrified, and that scared her too much. And that, no doubt, Miss did not take any action on her because of her past record was very good. She was a very obedient child. But just her name being told to the teacher, she got scared. And this, from then on, in the next week, suddenly this swelling happened, this fever came, and then the symptoms which they had come to me, it came up. So the event, the causation was this blame. The causation was the fear. She got very angry on those friends of hers. She was very angry. But this causation triggered the disease. Okay, now, so we had to, as our protocol is, we have to go deep beneath in the history of the parent. So when her mother's history was inquired, during pregnancy, her mother had, I'm sorry, her mother had hypertension and she was very much tensed. She was staying in village in the countryside. So her mother was very much tensed the whole time. She used to think about it. Okay, what will happen? My BP is so high. My blood pressure is so high. What will happen? How will I overcome this pregnancy? How will I deliver properly? She was staying with her in-laws over there in the village, and husband was away from her. Husband was working in a city and she was away from her. So that continuous apprehension, anxiety was there in her. And she was also taking hypertensive medications during the whole pregnancy. So now we have a clear picture in front of us. The child got, and the incidence was, the child had come to us with an autoimmune disease with the results positive for ANA test. The mother's history was too much of apprehensive. So the matter with us prescribe is mother is apprehensive and anxiety and having hypertension. The child is very sincere, obedient. She wants a good opinion of her from others. And she got sudden anger and fright because of this prank made by the children in a school. So we have the platter ready. We know the case is syphilitic case because the autoimmunity condition is so high. So the miasm is syphilitic, that we know that where we have to start from. So this is all our observation going further. So the causation was ailments from anticipation, which was a mother's history. Mother's history during conceiving, so much of anticipation, so much of apprehension her mother had. So we had to consider the mother's history when we are prescribing. So ailments from anticipation. The presenting child's ailments from fright and anger. Because what? She was angry towards her friends who had made a prank. And there was fright also that now teacher will tell me something. Because she has always been, her miasm has always been showing her that she's a good, disciplined child. She wants to please others. So we got two major causations. The maternal history is anticipation. The child's history is anger and fright. Okay. Her sensitivity. Always at home, why she, when probed, why you want to be such a good child? Why you want to be such an obedient child? Because she does not want anybody to criticize her. She does not want that her image should be spoiled in front of anybody. Okay. She did not want that her grandparents tell, Kari, she's like this, she's not doing things on time. So she has always been very good. So her sensitivity is criticism and good opinions about her should happen. And another sensitivity which says, I don't like noise. Too much of noise in the school, I don't like. So noise. So these three sensitivity we got. What is her location of the disease? What she has come up with? She has come, the location is muscles and the joints, which are the supporting system of the body. The muscles and the joints, the bones are the supporting system of the body. But she's also come with the autoimmunity. Okay. So what is autoimmunity? When you are not able to stand up for yourself, when you are not able to put up your opinion, when you are not able to revolt yourself. Okay. So autoimmunity started in her because of the miasm. So we have a causation, we have a sensitivity, we have a location where the disease is. Now what our understanding is, we need a drug which is sensitive drug. We need a drug which needs respect. We need a drug, a 6-year-old child knowing so many things, that she's good at art, she's pleasing others, keeping all the things in place. So we need a drug which is precocious very much. Her understanding is so high. We need a drug who is image conscious. We need a drug which is which wants love and affection from others, and she's also showing that she greeted me with so much of pain. She is greeting me. Okay, so we need a drug which has love and affection. So this is a totality which we are creating, right from conceiving history till what the presenting symptoms are. So once the totality is made, once the dots are connected, we come to a further step of analyzing. So we analyze the whole case. Okay, so we do not want a drug who is very revoltious, injustice, intolerance, or fighting. So many of the drugs are ruled out directly. We want a drug who wants love, attention, wants respect, who is precautious, who is having anticipation in her, who is having fright and anger in her. Okay, so going further, we repertorize the case. These are the sensitivity to criticism, ailments from anger, fright, ailments from anticipation, which was her mother's symptom as well. Okay, precocity in children, obesity, order desire for she wants everything neat and tidy. Okay, so we have to see the case as it is, no prejudices at all. What she has bought, what is at the top layer, we have to consider that and we have to prescribe. Okay, so autoimmunity is there. These are her symptoms. There is inflammation of the joints, pain in the lower limbs, motion is impossible for her, heaviness in the lower limbs as if she's dragging her legs. So the whole totality from the date of conceiving till now is taken. And the drug of choice was carcinosin. Thick hair. Dr. Ashok sir also said the same case, carcinosin, the good girl syndrome. So she was the same case. The good girl wanted to please others, wanted to be always in the good books of the teachers, of the grandparents. And because of the anticipation, because of the anger and fright, that would spoil her image, right? When if she showed her anger, if she showed her fright to others, that would spoil her image. And that event triggered the syphilitic miasm in her. And the disease came out as autoimmunity. So the root, we are treating the fruits by treating the roots. The fruits won't get healed unless and until we treat the roots. So if we just give superficial remedies, which will treat only joints, which will treat only superficial inflammation, so we will not get cure anytime. If we need a cure which is permanent, which is gentle, as in our aphorisms by Samuel Hahnemann, sir, we need a medicine which will treat the root. So the history from the details. And if we are giving only specific remedy, we will not get a result. If we are giving only a medicine which will only cover the joint complaints, or if we are giving a remedy which will only cover the desires of the fish, or we are giving a remedy which is only covering the mind, partial similar remedy won't work in autoimmunity, or in fact, any cases when we are dealing with homeopathy. So the right choice, hitting the bullseye in this case, was carcinosin. So carcinosin was given to her. She is a patient who had come to me in 2024. She's still on treatment with us, but she has improved drastically. So carcinosin 202 doses were given to her, and I give SL over here. 4 pills 3 times a day for 2 months were given. The potency chosen was 200. I did not start with a lower potency nor with a higher potency. Started with a medium potency. So that, because why to choose a medium potency? We have to see the sensitivity of the vital force. How sensitive the vital force is. Is it so deranged that she cannot heal herself? Then we have to give lower potencies. Or is it covering only the mind, or it is only very high doses, only the mind picture is clear and the physicals is not clear, then we go for LM potencies. But in her case, we had a totality. So we started with a moderate potency and only 2 doses. One dose was given stat over here. The other dose was given after 15 days at home. And after 2 months, she was called for the follow-up. So after a month, what we have to expect? What we have to expect, we have to always keep in mind the Herring's law of cure. The Herring's law of cure is not just about downwards, within, outwards. We have to see that are the qualities of vital force coming up? Are we removing the layers of the miasm? Are we actually stimulating the vital force? So the qualities of vital force, the bliss, peace, knowledge, happiness, the feeling of well-being, is it being achieved after a medicine? So we have to see that. So after a month, the swelling had reduced. That was one thing, good thing. She had fever. The fever was on and off. And she used to go to the school because she's a good child, but pain was still there. I did not think to touch the medicine again because swelling had reduced and she was able to move. So it was better. We don't expect a very sudden good change because we are treating the deeper roots. We are treating the miasm. So we have to wait. Don't be in a rush to give another remedy if the patient is not better. Don't be in a rush to give directly a complete different totality. If a complete different totality is not seen, don't be in a rush to give another remedy. You have to observe what is the totality coming up. So she had come with the similar symptoms, not big, huge change, not much betterment. So I thought of waiting. Patience is the key which every homeopath should have. So we wait, we give her Seclec for 2 months again. After 2 months, she came to the clinic. She was walking better and still smiling. The same predisposition, the same disposition is going on because she's a good child. So she is smiling, greeting me. And she's hopeful. I want to improve, doctor. So no other medication. And the best part in this case, she was not an altered case. She was a fresh case. She had not come to me after taking steroids. She had not come to me after taking any antibiotics or any other painkillers. She was freshly come directly to homeopathy. Thanks to my friend who referred her, a allopathic friend who referred her directly to homeopathy and did not give too many steroids. So having good relationship with your co-doctors is very important so that you get a fresh case, first-hand case directly to homeopathy. So it is easier to cure because the vital force is not mutilated with external medicines impressions. The vital force has only its miasm which is being affected. The external other medication has not added fuel to the fire. So the cases which have directly come to homeopathy on the first hand have better results than the cases which are mutilated by other medicines. We can give along with it therapeutic measures, okay, physiotherapy, helpful supplements. These will aid to help recovery, but taking too much of steroids or chemical mediated medicines will alter the case. Okay, so this was the follow-up. Within this 2 months of medicines, she had an episode of diarrhea when she had gone to her village and had lots of fish in her diet. So that time also I did not rush to give any other medicine. I just told them to be hydrated, take electrolytes, and continue the regular medicines, whichever she had. And luckily, her immunity was getting better because autoimmunity was there, which this showed to me that she is healing because her autoimmunity is getting better. She is healing herself now. So the acute which came to her in this case started healing by her own default setting of healing. The vital force started healing. So her loose motions, her diarrhea was subsided in 3-4 days with because it was because it was an indisposition from outside. So we do not rush to treat it because the causation was the food, the indisposition which she had. So we do not rush to treat it. We just remove the indisposition which she had. Okay, and she was better with this diarrhea. No other medication given. She is yet on carcinosin, 202 doses, which I had given in the first week. The follow-up continued again and again. This follow-up which I'm mentioning is a few months before only. It has been 1 year almost. I did not have to repeat repeat the medicine. I did not have to give her any other medication also because her layer was the same, but she was improving. Okay, but she was improving, nor there was any other totality of any other drug coming up. There were few acutes in her case, which were treated by any acute medicine at that moment, but there was no big medications or no constitutional shift in her. So there was no big medicinal change in her case. In the last few months follow-up, I'm so sorry. last few months of follow-up, she was very happy because her height had increased, which is obvious. She had lost weight also. Uh, she was happy and she wanted to take parts in the sports in school. A child with having muscle and joint problem, she was so optimism. Now I am able to walk freely, I am able to run, I'm better, my muscles are better. So I will now take part in the sports activities, in athletics in school. And this is very important sign. Her vital force was positive. Her vital force was happy. So the quality of the vital force had come up. She was able to accept, and also she was able to accept the people around her. Now she was not getting offended when friends mocked at her or teased her. She was keeping things okay. She was not too much in mind that everything has to be in order, everything has to be in order. The syphilitic mind was getting on a psychotic, psychotic level. She was okay if books are here and there. She was okay if her art was not little better. So she was in acceptance mode and not in a conflict mode. You have to always see when there is a conflict mode and when there is an acceptance mode. Conflict mode is a disease, acceptance mode is a healing. So once she was in a healing phase, we are continuing her treatment, yet she is on Saclac only, yet no other medications changed. And I have told her, advised her to repeat her ANA blood test so that we get. So it has been almost 1.5 years she is on treatment. And coming forth, if she gets her ANA blood test and the result is better, I will surely share with Genoveva and with all of you. So this was a case of carcinosin where not much of changes had to be done because her totality was the same. Okay. So going further, I have time yet, Genoveva?
Yes, you have 10 minutes. You can we can make a discussion or you can say anything more.
Yes, 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 yes.
If
Any
there are
questions anybody
questions.
has? Any questions? Are the people around?
Someone says phosphorus. Can we think of phosphorus? There is a question.
Yes, we can think of phosphorus, we can think of natrium mur, we can think of ignatia. We can think of so many this because these are all good girl responses, the good girl. But why carcinosin came up? Carcinosin, if it would have been phosphorus, phosphorus would have been more unattached. She would not be so much of, and she is very much, phosphorus is a very diffuse drug. She will, very diffuse drug. She'll mix with people, mix with children around in the school. She will not take criticism so much to the heart. A phosphorus does not take things too much to the heart, but she takes carcinosin or natrium more, in fact, takes things to the heart. Opinion, what others think about them, what is their image in front of others' eyes is very important for natrium, for carcinosin, for cilicia, yes. But there are no symptoms of cilicia. Okay, she's so spick and span. She's a good child. She wants to improve herself. She wants everything in order. She's not that obstinate like cilicia. So we have to differentiate when the drugs are there. Okay, so phosphorus is ruled out because there is no diffusion in her. Cilicia is ruled out because she is not having that kind of constipation. She is not having that kind of obstinacy. Okay, cilicia is also image conscious, but cilicia, the constitution does not match cilicia. Okay, so any other questions? And repertorization. Of course, when we have taken a totality, our repertory is covering the whole totality. If it is missing, the totality is missing, then we have many thoughts that these drugs are to be avoided. But the totality was covered in repertorization and the symptomatology. She did not come up with any other new symptomatology in coming follow-up. So carcinosin was done. ANA blood test, I have asked her to do again. She'll be sending me in this month. Being knowing autoimmunity results do not shift so easily. Symptomatically, the patient is much better. In fact, she is just running around. The results for autoimmunity to vary might take some time. That is what I suppose. But I have asked her to do her test, and probably she'll be getting them in the next month. Okay. I had one more PPT, but we don't have that much time.
We have 6-7 minutes.
Yeah. So whenever in children, we'll just sum up what we have spoken. In children, it's not only about autoimmunity, but any cases like I have shared a case of autism. I had sent a case of autism with Genoveva on the seminars page. So whenever we see any case, and this autistic child is improving very much, very good eye contact, he started calculating also. He knows his potty, and so training also, he's folding clothes. So when autism cases in children come to us, when they're fresh cases, uh, as a child, we can treat them much better. We can make them good human beings. We can make them, because autism is between animals and between normal human beings. They are in between. So we can bring them from animal behavior to better behavior if and only if we see the totality, if and only if we study the miasm of the person from conceiving till the date they had come to us. So history is very important. The totality is very important. So we have to be a good observer. We have to be an unprejudiced observer. We have to take the total history from causation, sensitivity, till date the patient has come to us. Okay, hobbies and interest, how they behave. So learning the body language is also very important. We have to study how the child reacts with the peer. So this is in sum up of what we do when we are studying a pediatric case. Okay, and yes, and I would when we as a homeopath, everyone must actually know spirituality. We must grow ourselves by doing meditation. We must seek our path inward, because a good homeopathic doctor can cure better when he is able to see within himself, see himself in his journey from a syphilitic miasm to a soric miasm. So we are here in a journey where we have to refine ourselves also, because we might, being a Jain, we might be having many birth lives. We might be in any soul, any body, any soul. But the journey of the soul is what matters. So what we imbibe in this lifetime will help us to grow in another lifetime. Okay, I think for this we need to read Bhagavad Gita, we need to read Agams. So spiritual evolution is very much important. As a homeopath, we need to study our own mind, how developed we are, how accepting we are with our own selves, how loving we are with our own selves. So we need to evolve ourselves first. Then only we'll be having the energy to cure the other souls as well. Thank you.
Yes, I agree with you, Rita. And this is actually a topic, a big topic actually, but it might be a theme of another conversation, probably personal, probably international. It depends on how we feel about this.
Yes.
And thank you very much. It
Thank you.
was a really very great response. It was a very interesting case with great response, and I admire your passion and enthusiasm in homeopathy. I wish you great luck
Thank you. Thank you very much.
in homeopathy.